This is the cannabis addiction slide presentation created by Shannon Victorino and Thomas Stross. Under the cannabis use disorder, the specifiers are mild, moderate, and severe. Under cannabis intoxication, there are two types of disturbances. One is without perceptual disturbances. This can be with use disorder mild, with use disorder moderate or severe, and without use disorder. Cannabis intoxication with perceptual disturbances, with use disorder mild, with use disorder moderate or severe, without use disorder. We also have cannabis withdrawal, other cannabis-induced disorders, as well as unspecified cannabis-related disorders. The DSM-5 criteria for substance abuse is applied to all substances. Two of the following must occur within a 12-month period and cause significant maladaptive patterns and distress. One is the recurrent abuse of the substance causing the person to fail to fulfill other obligations such as work or school, or perform these obligations poorly. Secondly, using the substance in situations that are physically hazardous. Another criteria is social or interpersonal problems caused by or exacerbated by the use of the substance. The criteria of tolerance is defined by either of the following: the need for increased amount of the substance, or the diminished effect with the use of the same amount of the substance. Under the criteria of withdrawal manifested as either of the following: characteristic withdrawal syndrome of the specific substance, or the same or similar substance is used to avoid symptoms of withdrawal. Number 6 of the DSM-5 criteria for addiction is a higher quantity of the substance is taken over a period of time that is longer than intended. The 7th criteria is that the patient has a desire to cut down, but unsuccessful efforts to do so. Also, a lot of time is spent on obtaining the substance, using the substance, or recovering from the effects of the substance. Another criteria is important activities are given up because of the substance, or the substance is continued to be used even though it causes physical or psychological harm, or there is a strong desire or craving to use the substance. When assessing for cannabis addiction, there are two screening and diagnostic tools. There is the alcohol, smoking, and substance involvement screening test, ASSIST, or screening, brief intervention, and referral to treatment. The World Health Organization created the ASSIST tool because of the overwhelming increased use of psychoactive substances around the world. It is used to screen for substance abuse in adults in the public health setting and faster to administer than most screening tools. The tool calculates a risk score that is used to begin a discussion with the patient regarding their abuse. The score is either low, moderate, or high risk and determines the most appropriate intervention. Regarding the screening, brief intervention, and referral to treatment, it is an approach used in the public health setting which delivers interventions and treatments for substance abuse, as well as early intervention to those who are at risk for developing a substance abuse. This tool quickly assesses the severity and identifies appropriate treatment levels. The interventions increase insight into the substance abuse as well as motivates behavior to change. There are several risk factors for becoming addicted. The first one is psychodynamic factors. Some psychodynamic factors can be a defense against anxiety self-medication, approval from friends, a manifestation of oral regression, a reflection of a disturbed ego function. Among the genetic factors, there are the twin studies have produced strong evidence for a genetic component of addiction. And lastly, there are neurochemical factors. Tolerance develops after using the substances. The major neurotransmitters systems involved are the opioid, catecholamine, and the GABA. Common effects for using cannabis are red eyes, dilation of blood vessels of the conjunctiva, mild tachycardia, orthostatic hypotension at high doses, increased appetite, dry mouth, heightened sensitivity to external stimuli, impaired motor skills for up to 12 hours after use, and paranoia. Some of the effects of long-term use are cerebral atrophy, birth defects, chromosomal damage, impaired immunity reaction, alterations in testosterone levels, menstrual dysregulation, and cognitive impairment. When a patient goes into withdrawal, the symptoms start within 1 to 2 weeks after cessation of daily cannabis use. Some of those symptoms include cravings, irritability, insomnia, anxiety, vivid dreams, decreased appetite, weight loss, depression, restlessness, sweating, headache, tremors, chills, and stomach pain. Treatments that can be used for withdrawal include anxiolytics, benzodiazepines. These provide short-term relief of withdrawal symptoms from prolonged cannabis use. Also, antidepressants can be used. An SSRI or SNRI may be appropriate for some patients since cannabis use can be related to unresolved depression. As with other substance use disorders, non-pharmacological treatments include a strong support system and abstinence, by which education is a priority. Motivation is to stop using is enhanced when patients understand intellectually why they are using substances. There are many avenues of support, including group or family psychotherapies, CBT, interpersonal therapies, behavior modification, abstinence, direct interventions such as inpatient hospital program, which require careful monitoring on an outpatient basis. There they can provide drug screens, which can detect cannabis for up to 4 weeks after use. There are a few national organizations and support groups. One is SAMHSA, the Substance Abuse and Mental Health Services Administration. Another is National Association of Addiction Treatment Providers. Below are a list of local organizations and support groups within the Florida Boca Raton area. So what do providers need to know about this disorder? They should know appropriate use of screening tools, risk assessment, appropriate community resources to refer patients, medication options for treatment, appropriate psychotherapy referrals, local rehabilitation facilities, clinical features of cannabis use disorder, appropriate use of medical marijuana, and state laws governing its use. What should patients and families need to know? Patients and family members need to know that there are support systems available to them and that they are not alone. They should learn about triggers to avoid in order to support sobriety and learn about signs and symptoms of cannabis use in order to intervene early in a supportive manner. Here are our references. Thank you for watching our presentation. Epstein did not kill himself.